Are you suffering from fatigue or maybe some discomfort in the right upper abdomen? Are you experiencing any weight changes that are unexplainable? Well, you may have what's called fatty liver disease. Hello, everybody. I'm Dr. Davari, and in today's video, I'll be talking about fatty liver, what it is, signs and symptoms to look out for, and foods that can help detoxify the liver. So, what is fatty liver? Fatty liver is also known as hepatic steatosis. It's a condition where excess fat will accumulate in the liver cells. There are two main types. There's non-alcoholic fatty liver disease, and this occurs in people who drink little to no alcohol. It's often associated with obesity, insulin resistance, and metabolic syndrome. It can progress to inflammation of the liver, fibrosis, or even cirrhosis in severe cases. We also have alcoholic fatty liver disease. This develops as a result of heavy alcohol consumption. Excessive alcohol intake interferes with normal metabolism of fats, leading to fat buildup in the liver cells. In its early stages, fatty liver may not cause noticeable symptoms. However, as it progresses, it could lead to liver inflammation, scarring, and impaired liver function. Addressing the underlying causes, such as improving your diet, losing weight, or reducing alcohol intake, is the key to managing and potentially reversing this condition. So, what are some signs and symptoms to look out for? Fatty liver disease often presents with few or no symptoms, especially in the early stages. So when symptoms do occur, they can be subtle and might include the following. You can feel fatigue, which is this persistent feeling of tiredness or low energy. You can have discomfort in the upper right abdomen area, and it usually feels like a vague pain or discomfort in the area where the liver is located. You can have weight changes. Some individuals may experience unexplained weight loss, or they'll have difficulty managing their weight. You can experience a loss of appetite. A decrease in your appetite can sometimes accompany this condition. In more advanced stages, such as when fatty liver progresses to non-alcoholic steatohepatitis or cirrhosis, additional signs may include the following. You can have enlarged liver, and this is often discovered during a physical examination. You can have jaundice, which is yellowing of the skin or your eyes, and it indicates more significant liver dysfunction. You can experience swelling, which is fluid retention, and it could lead to swelling in the abdomen or in the legs and ankles. You can experience itching, and this is a persistent itchiness that can be a sign of worsening liver function. Since many of the early symptoms can be mild or nonspecific, regular medical checkups are important, especially if you have factors like obesity or type 2 diabetes or high cholesterol. Some of the best foods to help resolve fatty liver disease obviously are going to include having a well-balanced diet that's rich in high nutrient whole foods. They can support the liver health and may help resolve or prevent progression of the fatty disease. Although these dietary recommendations can be beneficial, they should complement guidance from your healthcare provider. So here are some of the best foods to include in your diet. Include leafy greens and cruciferous vegetables. Examples will include like spinach and kale and broccoli, Brussels sprouts and cauliflower. The benefits of them are that they are high in fiber, antioxidants, and anti-inflammatories, and they can help reduce liver fat and support the detoxification process. Incorporate healthy fats into your diet like olive oils, avocado, nuts, and seeds. These healthy fats, particularly the monounsaturated and omega-3 fatty acids, can improve insulin sensitivity and reduce liver inflammation. Fatty fish like salmon, mackerel, and sardines are also excellent sources of omega 3s. Incorporate whole grains into your diet like brown rice, quinoa, and whole oats and barley. Whole grains are high in fiber. They can help to regulate blood sugar levels and support a healthy weight, both important for managing fatty liver. Incorporate lean proteins like skinless poultry, fish, legumes, and tofu. The benefits of these are that adequate protein intake is important for repairing liver cells and maintaining overall health, while lean sources help reduce excess calorie intake. Fruits are rich in vitamins, fiber, and antioxidants. Berries, in particular, contain compounds that can help reduce liver inflammation and improve overall liver function. Garlic and onions. Both of them contain compounds that have been shown to support liver detoxification and improve enzyme activity. Incorporate green teas into your diet. They're rich in catechins. Green tea has antioxidant properties that may help reduce the liver fat and inflammation. Here are some additional tips. You want to limit your added sugar and refined carbs because reducing foods like sugary drinks and pastries and white breads can help manage blood sugar and prevent further fat buildup. Watch your portion sizes. Even healthy foods can contribute to weight gain if consumed in excess, so moderation is key. Stay hydrated. Drinking plenty of water supports overall health and metabolism and helps the liver process and eliminate waste. By integrating these foods into a balanced diet, along with regular physical activity and other healthy lifestyle changes, you can work toward better liver health. Always consult your healthcare provider or a nutrition specialist to tailor a plan that suits your individual needs. I hope you enjoyed this video. Don't forget to hit the like, share, and subscribe button. It helps my channel grow. And please, in the comments, leave me a comment on the next topic you'd like me to cover. Until then, make it a great day.